the psychological factors involved in ED? We discussed ED in general and some of its causes. Most physically caused cases of erectile dysfunction stem from a handful of diagnoses including diabetes, high blood pressure, obesity, and heart disease, all of which affect blood flow. If you are suffering from any of these overarching causes, resolving these may eliminate the ED problem entirely. In this video, we look beyond the physical causes of ED and expand on the psychological factors that can cause it as well. For those men who are basically healthy and still suffering occasional ED, and under circumstances that point to psychological factors, there are several ways in which our frame of mind can affect our sexual experience and performance. It has been estimated that no less than 10% and as much as 20% of all erectile dysfunction cases are attributable to psychological factors rather than physical ones. To illustrate psychological factors in erectile dysfunction, consider the example of a healthy 35-year-old man who is able to achieve and maintain an erection at home alone and can masturbate to completion. This man has no physical ED, as proven by his ability to remain erect and masturbate to completion in privacy. But many men who are able to do this also experience ED issues and in sexual scenarios with a partner present. This ED that shows up only under pressure is a good example of psychological erectile dysfunction, and there are several underlying causes. Beyond physical, here are the psychological factors that can cause ED. Childhood trauma. Unpleasant memories stemming from traumatic childhood events can create mental blocks against sexual intimacy that manifest as psychological ED. This cause is actually the least prevalent but can be challenging to move past. Speak with a doctor or therapist about troubling thoughts that enter your mind consistently when sexual encounters arise. They may be carrying baggage of early traumas. Stress. Stress at work. Stress at home. Stress about money, health, marriage, stress. When you experience stress, your body responds by secreting a hormone called cortisol. Cortisol can inhibit your body's natural ability to produce testosterone, which can affect libido, erection, and stamina. Stress can also interfere with the neurotransmitters responsible for communicating desire, which may depress both interest and erection. Performance anxiety. Performance anxiety is the fear of inadequacy in action. When our minds harbor concerns about our ability to perform, it can become a self-fulfilling prophecy, reducing our ability to perform based solely on the fear of the same. This problem becomes cyclical. Anxiety causes ED, which causes anxiety. This loop can be difficult to depart but in reality is purely psychological, not physical. Depression. Depression can cause erectile dysfunction in otherwise sexually and physically healthy men. Because depression unsettles the psyche, many depressed people narrow their thinking to remove unnecessary stresses. Non-essential functions like intimacy and desire tend to be sidelined by the brain in those that suffer from depression. To make it worse, antidepressant drugs often cause ED. To move past this, discuss your scenario with the doctor who prescribed the antidepressants to see if a better regimen is available. Self-esteem struggles. The act of seduction is one requiring enthusiasm, confidence, and a sense of well-being. Fear of rejection is most acute in those struggling with self-esteem, and this fear can lead to erectile dysfunction. Self-esteem comes from performing esteemable acts. So recommit to the gym and to your grooming and dressing routines to heighten your confidence in this area. Most of the physical causes of ED are absent in younger men. So psychological causes of erectile dysfunction are much of why young men experience ED at all. To determine if you are suffering from psychological causes of ED, ask yourself these questions. Do you have known psychological causes of ED? Like depression or childhood trauma, are you able to maintain an erection well enough to masturbate to completion, but experience erectile dysfunction when in a sexual scenario with a partner? Are there lifestyle factors involved, like smoking, alcohol consumption, or recreational drugs? Seek help if you answered yes to any of these questions or if ED is causing discord between you and your sexual partner. It is a lot to think about, we get it. If you like the video, give it a thumbs up and share it with your friends. If you want more tips, subscribe to the channel.